A woman can get pregnant if a man's sperm reaches one of her eggs. Contraception is free for most people in the UK. Condoms can also be bought in pharmacies and supermarkets. Many elements need to be considered by women, men, or couples at any given point in their lifetimes when choosing the most appropriate contraceptive method. These elements include safety, effectiveness, availability, and acceptability. Voluntary informed choice of contraceptive methods is an essential guiding principle, and contraceptive counseling, when applicable, might be an important contributor to the successful use of contraceptive methods. In this video we'll discuss the major birth control methods that are safe and appropriate. Adulteenhub. Caps. A contraceptive diaphragm or cap is a circular dome made of thin, soft silicone that's inserted into the vagina before sex. It covers the cervix so sperm can't get into the womb, uterus, to fertilize an egg. A diaphragm or cap is a barrier method of contraception. It fits inside your vagina and prevents sperm passing through the cervix, that is the entrance of your womb. You need to use it with a gel that kills sperm, also known as spermicide. You only have to use a diaphragm or cap when you have sex, but you must leave it in for at least 6 hours after the last time you had sex. You can leave it in for longer than this, but don't take it out before. The links for all the products in this video are given in the description down below. Contraceptive implant. Contraceptive implants are a long-term birth control option for women. A contraceptive implant is a flexible plastic rod about the size of a matchstick that is placed under the skin of the upper arm. It releases a low, steady dose of a progestational hormone to thicken cervical mucus and thin the lining of the uterus, endometrium. Contraceptive implants typically suppress ovulation as well. With a 99.95% efficacy, in terms of numbers, more than 99 out of 100 women will successfully prevent their pregnancy by using this. Benefits of the implant include fewer, lighter periods, improved symptoms of premenstrual syndrome, long-lasting, up to 3 years, smoker and breastfeeding safe, and the convenience of not needing to remember to use it every day. Male condoms. A male condom is a thin film cover that is placed over the penis. Condoms prevent pregnancy by keeping sperm from entering a woman's body. Condoms are either lubricated or non-lubricated. You can also add a water-based lubricant to a condom to make sex more comfortable and, more important, to help prevent breakage. At your local pharmacy, ask which brands of lubricant are water-based. Avoid oil-based lubricants, for example, petroleum jelly, massage oil, body lotion, as they weaken condoms and may cause them to break. Condoms are effective at preventing the transmission of most STIs, although there's still some risk. When used correctly, a condom creates a barrier that limits your exposure, and your partner's exposure, to semen or other body fluids that can carry STIs. Female condoms. The female condom is a soft pouch made of latex or polyurethane, that has 2 flexible rings at each end. It is inserted into the vagina or anus before having sex. The female condom is a soft, loose-fitting pouch with a ring on each end. One ring is inserted into the vagina to hold the female condom in place. The ring at the open end of the condom remains outside the vagina. The outer ring helps keep the condom in place and is also used for removal. The female condom can be used during anal sex, too. Female condoms are often made of polyurethane or nitrile, which is safe to use for people who are allergic to latex. Another benefit to polyurethane or nitrile female condoms is that they can be used with all types of lubricants. Be sure to check the packaging before use if you have latex allergies, or use an additional lubricant for compatibility. Combined pills. Combination birth control pills, also known as the pill, are oral contraceptives that contain estrogen and a progestin. Combination birth control pills keep your ovaries from releasing an egg. They also cause changes in the cervical mucus and the lining of the uterus, Endometrium, to keep sperm from joining the egg. With typical use, the estimated risk of getting pregnant is about 9%, or about 9 in 100 women on COCP will become pregnant in 1 year. It doesn't interrupt sex and there is no evidence that it causes additional weight gain. Also, there are no long-term effects to your fertility if you use these pills. If you choose to take birth control pills, then we recommend you using the pill box to store your pills in an organized way so you don't miss any of them. These can be your perfect pills storage that are easy to carry anywhere. The link is in the description. Contraceptive injection. The contraceptive injection is a shot that contains hormones, either a progestin alone, or a progestin and an estrogen together, that stop your body from releasing eggs and thickens the mucus at the cervix. You need one shot either once every month or once every 3 months from a healthcare provider. Each injection is more than 99.5% effective at preventing pregnancy and lasts for 12 to 14 weeks. If you have a late injection, it might only be 96% effective. It is very effective and most users have no vaginal bleeding at all or very light bleeding. Periods may also be less painful. Contraceptive patch. The transdermal contraceptive patch is a safe and convenient birth control method that works really well if you always use it correctly. You wear the patch on certain parts of your body, and it releases hormones through your skin that prevent pregnancy. The patch has lots of other health benefits, too. You only need to apply it once per week, unlike the pill, which you take every day. After 3 weeks, or 21 days, of use, you remove the patch for 1 week. It eliminates the need to interrupt sex for contraception. You don't need your partner's cooperation to use it. It doesn't require daily attention or having to remember to take a pill every day. Intrauterine device. An IUD is a small T-shaped device that is placed in the uterus by a healthcare provider. It sits inside the uterus, and the cervix keeps it in place. Once it is in, you cannot fill it. There are 2 types of IUD, the hormonal IUD and the copper IUD. The IUD works very well if inserted and used properly, and is one of the most effective reversible methods of contraception available. If 100 women use it for a year, fewer than 1 will become pregnant. It is extremely good at preventing pregnancy, and is easy to use and maintain. It is long-lasting and cost-effective. It is immediately reversible if you decide you want to get pregnant. Progestogen-only pill, mini pill. The mini pill is a type of birth control pill. It is made with progestin, a man-made form of the hormone progesterone your body makes. The mini pill has a lower dose of progestin. And because it does not have estrogen, the mini pill may have fewer side effects. The mini pill thickens cervical mucus and thins the lining of the uterus, preventing sperm from reaching the egg. The mini pill also suppresses ovulation, but not consistently. For maximum effectiveness, you must take the mini pill at the same time every day. Always have your next pack ready before you finish your current pack. Unlike combination birth control pills, mini pill packs don't contain a week of inactive pills. Vaginal ring. The vaginal ring is a small, flexible, plastic ring that you insert into your vagina to prevent pregnancy. It's about 2 inches around. The vaginal ring prevents pregnancy by continuously releasing synthetic estrogen and progestin. These hormones are absorbed into your bloodstream. If used correctly, the ring is at least 99% effective at preventing pregnancy. If you forget to put a new ring in, use it incorrectly, or take certain medications, it might only be 93% effective. It can be used to skip your period. Periods usually become lighter, more regular, and less painful. Your acne can also improve. Tubectomy. Tubectomy has become an increasingly prevalent form of contraception. Also called as tubal ligation, this surgical procedure is carried out to ensure that the fallopian tubes in the body are blocked, clamped, sealed, or severed. The main aim of this surgery is to prevent the sperm from reaching the egg to fertilize it. It is a permanent method of sterilization and there is no going back. During a tubectomy, the tubes are slightly cut and tied or artificial clips are placed so that the egg is unable to travel to the uterus. A tubectomy is deemed one of the best solutions in birth control. Since it is permanent and its success rate is as high as 99%, tubectomy is being opted by women in many parts of the world. Vasectomy. Vasectomy, also called male sterilization, is a surgical procedure. It is meant to protect against pregnancy permanently, so it's super effective. The small tubes in the scrotum that carry sperm are cut or blocked off, so sperm can't leave the body and cause pregnancy. The procedure is very quick, and you can go home the same day. And it's extremely effective at preventing pregnancy, almost 100%. A vasectomy is an effective and permanent way to prevent pregnancy. It's best for men who are certain they don't want children. A vasectomy doesn't have any lasting effects on sexual activity or performance. Natural family planning. Natural family planning is a form of birth control that doesn't involve pills or devices. As a result, you don't have side effects. With these methods, you track your fertility, which is when you are most likely to get pregnant. It can be quite effective in reducing the odds of pregnancy to less than 1% per year. However, since many couples do not use the method perfectly, the typical use pregnancy rate is closer to 25%. It does not require the input of a healthcare provider but leaves fertility within the couple's control. Contraception can be used to plan when women and couples have children and how many children they have. Girls and young women are especially at risk of problems in pregnancy. Contraception allows them to put off having children until their bodies are fully able to support a pregnancy. Contraceptive use slows population growth. This is important because overpopulation puts pressure on the environment, the economy and services such as education and health. Thank you for watching. See you in the next one. Stay sexy.